Hi, I'm Annelise Appleseth, and I'm presenting today on recurrent exertional rhamdomyolysis. It affects racing thoroughbreds. Because of the amount of pressure they're put on, they can become a little bit more susceptible to this disease, and it's thoroughbred racing horses with an autosomal recessive disease. So signs and symptoms of RER is pain and stiffness in the lower back, gluteals, and muscles in this region. You're also going to see a shorter stride in the horse, and even sometimes immobility of the horse. Because they're really uncomfortable, you're going to see a lot of sweating and an elevated respiratory rate. This is kind of similar to colic in the fact that you'll see a very uncomfortable horse. Usually, the horse doesn't want to go forward, but you can kind of tell the difference because you just worked the horse because it's an exertional disease. And you're also going to feel hard hind muscles in the hind end, and the horse isn't going to want to go forward at all as the symptoms progress. Sometimes it even gets so bad that the myoglobin in the cells break down and the horse will pee out brown urine, and the horse is excreting these dead muscle cells. So it can get really bad, so you want to keep a big eye out for this disease, and it's recurrent. So if it does happen once, you want to make sure that you're managing it well. A diagnosis is kind of tricky because it can be confused with tying up. The difference is that RER is an autosomal recessive disease. So if you see this chart here, you've got a mother and a father, and they're both carriers for the disease, but they don't actually show signs of the disease. So if you cross these two, you're going to have one affected non-carrier of the gene, and then you're going to have two unaffected carriers, so again, you're not going to see the disease, but then you will have one affected horse. So you wouldn't want to breed this horse back to either a carrier or another affected horse because you're going to get more affected horses. So the other way to diagnose this disease is on a history of muscle cramping. It's going to happen more than once. It's not going to be just a one-time thing. The other thing you can do is you want to look for elevations in serum, myoglobin, creatinine kinase, lactase dehydrogenase, and aspartase aminotransferase. These are, your veterinarian can come out and check them and will be shown up on blood work. So why does it happen? So there's a few possible triggers. You've got low electrolyte concentrations or even too high electrolyte concentrations during exercise, and the biggest one is a high-grain diet with lots of carbohydrates. That can cause storage of carbohydrates in the muscle cells, and the muscle cells don't know how to properly break down them. So here you've got an RER affected horse slide. These are the cells, and a normal horse slide. So the nuclei, which are the little black dots on the slide, you can see the nuclei are towards the center of the mature muscle cell fibers rather than in the normal horse cell. You'll see the nuclei underneath the cell membrane instead of toward the center of the cell membrane. So you can look at these two slides here. The treatment is not real. There's no true treatment of the disease. It's more of a management thing. So you want to make sure you're not breeding more affected horses. And when it does happen, you want to relieve the anxiety and the muscle pain, correct the fluid balance, acid-base deficiencies, and prevent renal compromise. So some drugs that are used are acetopromazine, which relieves anxiety and may increase the blood flow to the muscles, and methocarbamol, which is used as a muscle relaxant. What you don't want to do with an RER horse is just put it in a stall and leave it. You want to rest the horse in case there was muscle damage that occurred when it happened, but you don't want to just leave it in the stall. You want to be able to hand walk it, keep the muscles moving, and be able to control the amount of exercise that horse is getting. The biggest management for RER is changing the diet, so we'll talk about that in a minute. So, feeding the RER horse. You need to change the horse to high-fat, low-carbohydrate diet. So this would be a low-grain diet and a high alfalfa diet or roughage diet or legume diet. The problem is the horses need 20 to 25% of the total daily calories as fat. This is different than normal diets because the normal diet, the fat would be 2 to 3% lower calories in fat as what we're asking for the RAR horse. So we have to supplement fat sources, which we're going to use things like rice bran, corn oil mixed with alfalfa pellets, or spray-dried fats. Some feeds to avoid are corn. Corn consists of 71% carbohydrates. You also want to resist the use of sweet feeds because this has the same problem. Sugars and starches should also be less than 15% of the total daily calories. And it's recommended that these horses, these RAR horses, go on a high-protein diet to build muscle. Thank you so much for listening. Here's my works cited.